Hi everyone, this is our group project on the Dorothea OREM Self-Care Deficit Theory by Erica Burgess, Irene Alfarami, and Tracy Mahoney. The provision of healthcare services is an essential pillar that is utilized in enhancing healthy populations. In a move to improve the provision of healthcare services, several nursing theories have been developed and availed for use. Exploring the nursing theories contributes to comprehensive understanding of the healthcare system and consequently contribute towards improved patient outcomes. The task explores the self-care deficit theory by discussing the theorist's biography and philosophical ideas underpinning the theory. An American theorist, Dorothea OREM, developed the self-care deficit nursing theory in the 19th century. The theory focuses on self-care as an individual performs various activities to improve on own health and well-being, and has been used by nurses to improve on nursing. Dorothea OREM was born in Baltimore, Maryland, the United States, on the 15th of July in 1914. She was a famous nursing theorist who developed the SCD theory, the OREM nursing model. Dorothea went to Seton High School and completed her education in 1931. Dorothea then pursued a diploma in nursing at the Providence School in Washington and finished in 1934. She then attended the American Catholic School where she did her Bachelor of Science in Nursing and pursued her Master's in Nursing, which she completed in 1945. Dorothea died on the 22nd of June in 2007, at the age of 92, in Savannah, Georgia, where she had lived as a consultant. The self-care deficit nursing theory developed by Dorothea OREM advocates for the ability of individuals to perform activities to maintain health and well-being on their own. By the time Dorothea graduated with her Bachelor of Science in Nursing in 1939, World War II had already started. The nursing theory was a product of the war, as people needed to know how to maintain their health without nurses. During OREM's lifetime, women could attain higher learning up to the master's level. This development made it possible for OREM to develop the self-care deficit theory, or SCD. Notably, the theory focuses on people being able to maintain their health by having behavior changes when nurses are not available, just as advocated for by psychologists. Dorothea OREM created the SCD theory, which has a model of concepts in the practice of nursing. Self-care, according to OREM, is the actions that people can do deliberately and freely perform to maintain their health and well-being. The theory assists others in managing and providing self-care to improve human functioning at the home level. According to this theory, the nurse assists patients' deficits and looks for the best way to cater to the obligation. The idea has 4 cognitive operations: diagnostic, prescriptive, regulatory, and control, and focuses on nurses being able to establish a nurse-to-client relationship to determine the client's self-care requisite. OREM's theory of nursing is a grand theory comprised of 3 interrelated theories. 1. Self-care. This is the ability for individuals to perform care on their own to maintain life care and well-being. 2. Self-care deficit. This is the demand to care for oneself is greater than the individual's need to meet it. And the third is the theory of nursing system. This is when the nurse determines whether there is a legitimate need for nursing care and if a self-care deficit exists. OREM's self-care deficit nursing theory is logical, has been in existence since 1971, can be applied to nursing practice, is used to create nursing curriculum, and is utilized as a nursing theory worldwide. The self-care theory has added to nursing knowledge and has created new hypotheses in nursing through research. Dorothea OREM first published her self-care deficit theory in 1971. She expanded on her theory further in additional publications throughout the years, most notably in 1985, 1991, 1995, and 2001. The self-care theory can be applied to different nursing environments and patient situations and can be adapted to various nursing specialties, such as pediatric, maternal child, perioperative, cardiovascular, respiratory, rehabilitation, and critical care. This theory can be applied to many different areas of nursing care and can help formulate a nursing care plan. The theory can be applied to health promotion, care of the sick, and to teach self-care to patients. This picture illustrates an example of how to apply OREM'S self-care deficit nursing theory. The main concepts that make up the self-care subtheory are self-care requisites or needs, which can be broken down further into universal, developmental, and health deviation, and lastly is therapeutic self-care demand. The theory of self-care is focused on activities that people can perform on their own and include physical and psychosocial needs and activities of daily living. This promotes health and prevents illness. Self-care, the first concept, can be defined by the purposeful fulfillment of one's needs in order to maintain continued life, growth, development, and maintenance of human integrity. Self-care requisites can be defined as the actual needs oneself has. They are done with intent as to maintain human functioning or enhance development. These requisites can be broken down into universal, developmental, and health deviation. Universal needs are basic human needs for survival, such as air, water, food, activity, rest, and safety. Developmental is further broken down into maturational and situational, which are defined as progression or maturation and prevention of harmful effects, respectively. Next is health deviation self-care requisites, which come up based on the patient's specific condition. Therapeutic self-care demand is the idea that nurses must assist patients regain control of their independence in a therapeutic way. As previously mentioned, the theory of self-care deficit is the focus of OREM'S grand theory of nursing. One of the assumptions is that all persons desire to care for their own basic needs. When a person falls ill, disabled, or is limited and they cannot perform self-care activities on their own, there is now a need for nursing assistance. OREM believes that self-care enhances recovery and well-being. This model is largely used in rehabilitation and primary care. Main concepts within the self-care deficit theory include deliberate action, nursing system, and product of nursing. OREM came up with 5 ways of helping or assisting: the act of doing for others, guidance, support, providing a therapeutic environment for one's development, and educating others. The concept nursing system is formulated when a person becomes a patient in need of a nurse's assistance for self-care activities. It becomes fully activated when the client's therapeutic self-care needs cannot be fulfilled by the client's self. Deliberate action is the intentional action performed by the nurse with a goal that the patient will regain independence. The product of nursing is the plan of care that is rendered to each patient carefully and thoughtfully based on his or her specific conditions. Metaparadigm is the most abstract and general component of the theory hierarchy. It is defined as a global representation model that includes the major concepts of a specific discipline. There are 4 nursing metaparadigms, which are nursing, health, patient, and environment. OREM views nursing as an art that incorporates scientific knowledge and human service to provide assistance in managing self-care. Society says that adults should be able to care for themselves and perform their activities of daily living. But if there is a self-care deficit due to an illness or disability, assistance from others is needed in order to regain independence. Nursing can provide the human service for those with self-care deficits. Health is viewed as the state of an individual as a whole and his or her ability to perform activities of daily living. Self-care is vital to promoting health and also preventing illness. The patient or person is a holistic being composed of biological, physical, psychosocial, and intellectual needs. According to OREM, it is a distinct individual whom nurses and others deliver their care to. Humans are expected to be self-sufficient in daily care activities of their own and their dependents. Naturally, the patient desires independence and control of their life, and he or she is more likely to recover if independence is encouraged. The environment is defined by external stimuli that affect a person's adaptation. OREM describes the environment to feature family, culture, community, as well as physical, chemical, and biological elements. More specifically, the environment can be composed of family, friends, habits, dietary choices, activities, and social interactions. OREM'S concepts are all integrated with one another. Environmental factors can have an effect on one's health. For example, healthy eating habits and activities and social interactions with friends and family will all help nourish one's mind, body, and soul. But if you add negative factors such as poor dietary choices and self-destructive habits such as smoking or excessive drinking, it can result in poor health outcomes. When people fall ill or disabled and are no longer able to care for themselves, it causes a self-care deficit and they are now a patient. Nurses come in to provide care and help restore their independence and overcome the deficit. After the patient is cared for and has made a recovery, he or she will be able to fulfill their desires to care for themselves again. Depicted here is a graphic model representation of OREM'S theory of nursing. The outermost ring is the theory of nursing system, and it is the most broad range. Within that circle, and slightly more specific, is the theory of self-care deficit. Next comes theory of self-care, which is broken down into three smaller parts. The wholly compensatory system represents complete care from the nurse. The partially compensatory system depicts when a client can only partially perform self-care needs. For example, one who can brush his teeth but cannot bathe on his own. A supportive or educational system is when the nurse simply provides assistance or education on self-care to the client. For example, an individual may need occasional guidance or a small assistance with bathing, but can mostly do it on his own. OREM'S theory of nursing self-care deficit can be applied to the nursing practice in a clinical, educational, or administrative setting. Nursing schools have been incorporating or basing their nursing curricula on this theory. From a clinical standpoint, hospitals base nursing care on this theory throughout the nation. Here is an example of how OREM'S theory is applied in nursing practice in the clinical setting. Children who undergo hemodialysis are faced with a deficit in practicing self-care, negatively affecting their quality of life. With a self-care support training intervention program in place, children were taught how to adjust to the new types of self-care related to their hemodialysis care, such as shunt care, diet, treatment, urine measurement, blood pressure measurement, medications, and complication management. Plans of care were specifically tailored to each patient based on each one's needs. Following the training, there was a significant increase in quality of life in several aspects of life, including physical, emotional, social, and academic. This study demonstrated that OREM'S self-care deficit theory can be applied in developing training programs for children undergoing hemodialysis.